There's a brand new program that's a game changer for Hawaii residents looking to become a pharmacist. It's called the PharmMD XO, an extended online pharmacy degree. October is American Pharmacist Month, and there's an urgent deadline. Applications for the first ever cohort are due on December 1st. Joining us now to talk story is Dr. Rei Matsumoto, the Dean of the UH Hilo Daniel K. Inouye College of Pharmacy. Aloha and good morning, Dr. Matsumoto. Thank you so much for stopping by with us. And also, very grateful for the beautiful lei you brought over from Hawaii Island. So thank you so much.
Nice to be here.
So what do people need to know about this program?
Well, the great thing about this PharmMD XO program is that it's really designed for working adults. So working adults continue to live and work in their communities, support their communities while pursuing their coursework online. They do come to Hilo once a year for a very short period of time to do the hands-on pieces of their learning that they need, but it's a way to keep our workers in the community. Many of our students are currently working in supportive roles in healthcare systems, as well as in pharmacies. And so we would like to keep them in the communities, serving their communities and their families as well, while being able to pursue career advancement.
It will also be nice to take that trip to Hilo. I'm sure a lot of folks will enjoy that. What are some of the difficulties of getting pharmacists here in Hawaii?
Well, I think there's a lot of challenges everywhere in terms of healthcare. In Hawaii, we have a lot of areas that are rural and underserved, and that's always been a challenge. There's a shortage of a lot of different types of healthcare professionals there. And so in our rural and underserved areas, pharmacists and pharmacies in particular are very, very valuable. About 90% of Americans live within 5 miles of a pharmacy, and they have about double the operating hours of physician practices. So what that means is that when our patients need a healthcare provider, we're there on the, on the evenings, weekends, and holidays to supplement all of the other types of care that are available. And particularly in certain areas, the pharmacy may be the only place and the only healthcare provider that's available and accessible on a daily basis.
How do we get pharmacists into these underserved areas?
Well, that's one of the reasons why the College of Pharmacy here in Hawaii is located on Hilo. I think most of our other health professional programs are based in Manoa. But because we're based in Hilo, 80% of our classes are Hawaii residents, and the other 20% of individuals are coming from all over the world, but they're all from rural and underserved communities. So that's one of the main missions and one of the uniqueness of our pharmacy school, really growing health professionals for the state and other rural and underserved communities.
And how do you feel like this helps keep pharmacists here in Hawaii?
Well, it definitely will help keep pharmacists here in Hawaii, because working adults who aspire to be pharmacists never have to leave their homes, right? They're embedded in their communities, embedded in the places of work. They stay there, continue to serve their communities, and go and pursue their education online. And so we know that if we, individuals who are from the communities are more likely to return back to their communities to serve it, and that increases even higher if they never have to leave in the first place.
Yeah, that's a great point. Who do you feel like should consider getting into this program?
Well, anybody, for pharmacy in general, anyone who's interested in healthcare should consider it. And one of the characteristics of people who pick pharmacy versus other healthcare options, they want to pursue medicine, but clean medicine, minimal on the blood and guts. And then they also want a challenging career, doctoral level of training, but they also want a life. So that work-life balance with a challenging career, that's perfect in terms of pharmacy. And then particularly for the PharmMD XO, for those individuals that need to stay in place to support their families because they're working or they have caregiving responsibilities, this is the perfect program for them, specifically designed to be able to balance, a rigorous educational program while taking care of family and communities.
Yeah, that's the first thing that stood out to me is caregiving. Whether you're caring for kupuna or as a parent, I got a lot of friends who are looking at career changes possibly that do have keiki. That's a great point right there. Changes recently to federal student loans. Yes. I think a lot of people might be concerned about, maybe paying more for education. What do they need to know?
So first of all, the pharmacy education here in the state of Hawaii is very affordable. Still, expensive, any kind of education is, but much more affordable than pharmacy programs in other parts of the United States. In addition, the Grad Plus loans, which is the federal loan type that is the primary way that health professional students have historically pursued their education. That will be ending in July of 2026. So for those individuals who will be part of our inaugural class in the EXO, which starts in January, they will be eligible for this. For those who are pursuing pharmacy education after July 1st, we still have wonderful opportunities here in Hawaii, especially if you're a Hawaii resident. The tuition for pharmacy school is below the new caps that will be put in place, and we work very closely with our students to identify opportunities for scholarships, paid internships, and as well as other employer-provided incentives that are there. And of course, with the XO, you have the option of continuing to work to help pay for your education as well as the rest of your life while pursuing school.
So many wonderful options. Where can folks go to find out more information?
So the best way to find out more, and I encourage you to do this sooner rather than later, because the navigation of the application process can be daunting for many individuals, reach out to us. We are happy to work with you and to really kind of walk through your particular situation and options to make sure that you're positioned for success during the application process, the interview, and your future career as a pharmacist.
All right, Dr. Ray Matsumoto, appreciate you joining us all the way from Hawaii Island to share more information on this wonderful program. Appreciate you.
Thank you.
Aloha.